Hello, everyone. Welcome to today's HealthLine webinar from the American Association of Kidney Patients, titled COVID-19 Kidney Patient Planning for a Safe Holiday Season. My name is Erin, and I am AAKP's Director of Patient Insights, Data Analytics, and Advocacy. I oversee our patient research and education activities, as well as our grassroots engagement activities, including our Ambassador Initiative, which falls under our Center for Patient Engagement and Advocacy. The ambassadors comprise highly motivated and engaged patients, caregivers, and living kidney donors around the country and the globe. These individuals have a direct connection to kidney disease and wish to raise awareness and provide support to others navigating the challenges of this chronic disease. AAKP's HealthLine webinars fall under our Center for Patient Research and Education. We believe patient and caregiver education is an integral part of treatment and protection of patient lives, and we work to ensure that the patient has a central role in research and guidance that are designed to determine optimal approaches and strategies for providing healthcare services, assistance programs, and access to new products and services. This is especially true during national emergencies such as the coronavirus pandemic. We built this center with the latest polling and engagement technologies to ensure that kidney patients take a central role in informing the federal, academic, and private sector research, shaping the next generation of healthcare services, assistance programs, and innovative new treatments. And we encourage you to respond to our flash surveys and other engagement opportunities. At this time, I'd like to introduce AAKP's President, Richard Knight. Richard is a former in-center hemodialysis patient who received his kidney transplant over 15 years ago. Richard, I turn things over to you.
Thank you, Erin. Erin, and I want to thank you because you've done a great job in pulling these webinars together, and this one in particular, as we prepare to celebrate for the holiday seasons. And I want to thank everyone out there who's shown concern for kidney patients during this period of time in which we're currently existing with COVID-19. And secondly, I would like to thank Dr. Silberzweig for sharing his time and expertise with us today. As we all know, this virus has been a serious threat to all Americans, especially those of us who are immunosuppressed, such as myself and my fellow kidney patients. This is something that has been of concern to us for quite a while now. But the holiday season, from our intro, you can see the holiday season is upon us. It's approaching fast. And I think it's special to all of us. So we must balance our desire to fully celebrate the holiday seasons pre-COVID we must balance that against the current reality in which we live. And Dr. Silberzweig joins us today, and he's going to provide some additional guidance and some reminders that can help us get the most out of this holiday season. And the good news is that he is a very patient-friendly nephrologist, and he's worked with AAKP on a number of occasions during the past 5 years. So we appreciate him taking his time to be here with us today. Now, his presentation today is going to provide insights and updates on COVID-19 and just in general some do's and don'ts for you to take into consideration during this holiday season, because our utmost concern is keeping you safe and healthy as well as your loved ones. So I'm asking all of you who are listening today to join AAKP in our social media and our efforts to educate patients. We think that there's a lot of information that we have shared, other organizations have shared, but we must continue to reach out and educate patients, particularly as it appears that things are getting better. We can't let our guard down. So to continue on with the discussion, I'm going to turn the conversation over to my fellow transplant recipient and AAKP's Chair of Policy and Global Affairs, Paul Conway. He's going to talk about some survey information that's going to be very insightful to you. Paul?
Hey, thanks a lot, Richard, and appreciate it, and appreciate the good doctor being here from the Rogosin Institute. Doctor's worked with us, as Richard indicated, for 5 years or more, and he's a staunch ally and a vigorous defender of using patient insight data to inform policy and medical decisions. So what we'd like to do right now is run through a series of slides for you that show some insights that you, the patient community, have brought back to AAKP about where we are right now in terms of defending ourselves with proper vaccinations, and also what our expectations are going into this holiday season. So on this particular question, this is where we asked, where are folks in terms of doing the right thing and getting their vaccination doses? And you can see here that right now we're sitting at 59% with their third dose, 31% have their second dose and are getting ready for the third dose. And what this means to us is that as a community, we're doing the right thing. And for AAKP, we're educating people along the way to make certain that those folks that are at 2 doses get their third dose, and that we stay on top of new treatments that are coming down the pike for us. And on this particular one, we think it's pretty revealing. In this one, it asks how many folks were diagnosed, either themselves or their family, with COVID-19, and how many were vaccinated. And you can see here, 31% indicated they knew somebody, a family friend, that contracted COVID-19, 31% with 2 vaccination shots. And with 3, you can see the number 3% there. What this illustrates is the vaccine doses work. It's something that you've seen. You've heard from medical experts about this, but I would call your attention to the last column here, those who are not vaccinated. 60% are the ones, based on AAKP's membership, that are getting COVID-19. I think this reinforces the national point that's being made by the medical community and those we work alongside to try to defend ourselves, which is being vaccinated is smart and it's intelligent. Not being vaccinated exposes us to great risk, especially the family and friends that we surround ourselves with during the holiday season. On this, you see greater confidence with the kidney patient population in terms of where we are today in the pandemic and where we were last year as we head into the holiday season. So as you can see, last year concern was quite high. It's come down significantly. People are less concerned, and you still have a pretty good percentage that just are still trying to figure it out. But I'd call your attention to the drop of fear and concern over the past year. And again, this is related to the number of therapeutics that have come in and the more that we know about COVID-19 and how to stay safe. Now, this is something that's also very interesting. So you can see the numbers have roughly stayed the same in terms of those of us in the kidney community who know somebody in our family or in our circle of friends that's been infected by COVID-19. This is very important information because what it shows is just how pervasive and infectious COVID-19 is among those that we spend a lot of time with or would like to spend more time with. And then as we head into holiday season, we're asking certain things. As we saw last year, 72% of the kidney community indicated that they were changing their plans. And on this one, in terms of how we celebrate, this year looks a little bit more optimistic. Again, there are vaccines, there are clearer instructions about how to stay safe, as you will hear today, but the confidence margin has gone up to spend time with family. But this is an important point to make, which is as we feel more comfortable, we need to better arm ourselves and remind ourselves as a community and as families and friends what we have as particular interests and needs as immunocompromised or as kidney patients. In this one in particular, we asked folks if they had changed their plans, how did they change them? And you can see last year, nearly 60% of the patient community indicated that they weren't going to travel. Here you can see that number has improved a great deal. Also, along with instructions to family not to visit, that has come down significantly. Being a part of gatherings or virtual gatherings, you can see that number has improved as well. And where we shop for the holidays to keep our friends and family in mind, you can see that those numbers have come down fairly significantly as well. It means there's greater comfort in the community that if we follow protocols, we will likely be safe. But again, if you're immunocompromised in a kidney transplant patient, there are very, very particular cautions that we have to keep in mind. And lastly, we were asking if folks are doing the right thing on the vaccination front in terms of flu season. And you can see typically the kidney community is a very strong adherent to virus and to annual flu vaccines. And you can see we're doing a good job And as AAKP, we're educating folks to get the rest of us vaccinated for the flu on time. So at this point, what we'll do is we'll roll back over to Erin. And with these insights, keep in mind that what AAKP regularly does is we reach out and ask for you to participate in these flash surveys, because just as we've informed this webinar, we also inform policymakers in Congress and in the White House what the current feelings, beliefs, and views are of kidney patients on a host of different issues, particularly policy issues. And this is why it's very important, as Erin mentioned, when you get an email from AAKP asking you to participate in the survey, please do, and share it with other patients, because those insights we translate directly over to elected and appointed officials to inform good policy and good practice. Thank you very much. Erin?
Thank you so much, Paul. I'd now like to introduce our guest speaker for today's webinar. Dr. Silberzweig is the Chief Medical Officer of the Rogosin Institute, a nonprofit dialysis provider in New York City, managing 9 dialysis facilities and caring for about 1,500 patients with end-stage kidney disease, and about 5,000 patients with kidney transplant and 20,000 patients with chronic kidney disease. He is an attending physician at the New York Presbyterian Hospital and an associate professor of clinical medicine at the Weill Cornell Medical College. He is the co-chair of the American Society of Nephrology's COVID-19 response team. Thank you so much for joining us again this year, Dr. Silberzweig. We look forward to hearing from you about how to stay safe during this year's holiday season. I turn things over to you.
Thank you very much, Erin. I thank you and Paul and Richard for the warm welcome. It's always an honor to be here with AAKP, friends, colleagues, and associates, and fellow advocates for kidney patients. So I'll begin my comments with some thoughts on where COVID is now, and then we'll talk about protecting yourselves against infection. As Paul pointed out in the data that he's collected from many of you at AAKP, it's important to remember that influenza infections are around and that we can protect ourselves against them as well. We'll talk a little bit about what you can do generally to protect yourself. Just as a reminder, it obviously makes sense to talk to your individual physician as you prepare for the holiday season and who may be able to give you specific recommendations for yourself. Finally, we'll talk about COVID vaccinations and then some thoughts about celebrating the holidays this year. So first, I want to give some updates as to where we are in terms of COVID-19 through the end of October. So as of the end of October, 246 million people had been infected by COVID worldwide, and almost 5 million had died. At that point, you can see that there were about almost 46 million cases. Information that I received today from the CDC indicates that through November 9th, there have been 46.5 million infections in the United States and more than 753,000 deaths now. So more than 10,000 people have died in that relatively short period of time. So this shows you where we are in terms of cases, and this is an important number to follow. As you can see, over the past month, we've had a decline in the daily average number of new cases. But it's important to note that despite the fact that these numbers in this graph looks like a significant improvement, on October 28th, there were still more than 86,000 cases across the United States, and the 7-day average was still more than 72,500 new infections each day. So it's not, things are better, but it's not that COVID is gone by any means. The good news, again, is that infections are declining, and especially in spite of the fact that there are looser restrictions in terms of being able to gather in social settings. So in-restaurant dining is now permitted in most places, especially for those who've been vaccinated. Movie theaters are open to those who've been vaccinated. I'm in New York City, and the reopening of Broadway has been a big thing. Here, again, vaccinated persons are allowed in. And so we can really start to enjoy all of those things that we as individuals and with our families and friends enjoy. The really important news is that most hospitals are not overburdened by patients with COVID-19. I do understand there are some places in the United States where there are significant challenges in hospital settings, but not nearly what we had a year ago at this time. There are fewer patients developing COVID-19, And as Paul pointed out, in terms of the vaccinations, most of those who do get infected have milder infections. Obviously, all of that is very good news. So are we really over the worst? I always say it's important to interpret that kind of statement with caution. It looks like we're over the worst, but of course, last year at this time, it seemed like the infection numbers were coming down, and so there was a lot of hope that maybe we would be in pretty good shape come last winter and spring, and we did see a significant increase in the infection rates. So before we declare the worst over, we need to continue taking precautions, and we need to continue to monitor the situation. Many people across the United States are vaccinated now, and that's obviously very good news. And many people continue to practice preventive measures, so masks and social distancing, which we know are effective at reducing infection rates. Finally, I want to say that it's really important this holiday season to remember that you need two vaccines. You need vaccination against COVID-19, and that can be either a one vaccine series with the Johnson & Johnson vaccines in the United States, or the two vaccine series either with Pfizer or Moderna vaccines, and you need vaccination against influenza. The good news for those who haven't received either vaccine is that the CDC is now saying that you can receive both vaccines at the same time, or if you've been vaccinated against one, you can certainly receive the other vaccine at this point. So this looks at COVID vaccination rates in the United States. The data that Paul shows indicates that 90% of those who responded to the AAKP survey have received at least 2 doses, and almost 60% have received 3 doses. But across the United States as a whole, we're only at about 67%, only about 2/3 of the country has received at least 1 dose, and only 58% are fully vaccinated, meaning again, 2 doses of either Pfizer or Moderna, or 1 dose of Johnson & Johnson. So there's still a large swath of the population who is not fully vaccinated. And that's important to remember as we think about traveling and spending time with family and friends who we don't normally spend time with. Overall, 191 million Americans are fully vaccinated, obviously a very impressive number in less than a year with the vaccines available. The rates of vaccination vary considerably by state. In Vermont, more than 70% of the adult population is fully vaccinated. Obviously, vaccines only became available to children between the ages of 5 and 11 in the last week or so, so we're not able to fully account for those individuals yet. In West Virginia, only 41% of the population is fully vaccinated. And the data about different states and their vaccine rates is widely available on the internet. So before you travel, I would suggest taking a look at the vaccine rates wherever it is that you plan to travel. Of course, there are many factors that affect decisions to be vaccinated. Of course, there are the political factors that we've all heard so much about. There are medical factors. People have concerns about the safety of the vaccines and their efficacy. As Paul pointed out, the data regarding their effectiveness is very clear. And the safety data, given that, again, there are over 191 million Americans, and obviously many times that many people worldwide who've been vaccinated, indicate that the vaccines are in fact very safe. So many people have been concerned about how effective the vaccines are and have pointed out that significant numbers of people are getting what are referred to as breakthrough infections after being fully vaccinated. So this is data that's taken from the United Kingdom, and so I'm not going to get into the specifics of the individual vaccines because the Oxford and AstraZeneca vaccine is not available in the United States and is not really equivalent to the Johnson & Johnson or the other vaccines that are available. So, but I do think it's important to look at the totals, and if you look at the totals, 0.5% of those who've received 1 vaccine dose become infected, and only 0.1% of those who receive 2 doses become infected. Clearly, if you compare that to unvaccinated individuals, again, as Paul pointed out, the rates of infection are much lower. In the data he reported, there were twice as many infections among individuals who had not been vaccinated. So clearly the vaccines are working at reducing the total numbers of people who become infected, and more importantly, they're reducing the seriousness of those infections. So among the breakthrough infections, far fewer patients who become infected end up needing hospitalization, and the death rates are much, much lower compared to those who are not vaccinated. So the data, again, is very strong that the vaccines are very effective. So when should people be vaccinated against COVID? I suppose that it's a very easy thing to say sooner is better. There's no time like the present. Remembering that if you're planning to travel and spend time with family and friends who you don't normally spend a lot of time with, it takes time to build up antibodies against coronavirus, SARS-CoV-2, the virus that causes COVID-19, as well as to build up cellular immunity. And that has been shown to be even more the case in people who are immunosuppressed, like kidney patients, including those with transplants and those who are receiving dialysis. The mRNA vaccines, as you all know, require a series of 2 shots, and they're separated by 3 to 4 weeks, so that if you're planning on spending Christmas and New Year's with family and friends, there's still time to get both of those vaccines before you travel. Nowadays, it's also recommended that those who've received 2 doses of the mRNA vaccines, that is the Pfizer and Moderna vaccines, receive a booster, as well as those who received the 1-shot Johnson & Johnson vaccine. Now, it's important to recognize what the differences are, because many authorities are also recommending that rather than receiving 2 shots, patients who are immunosuppressed, and again, this includes all patients with chronic kidney disease, should receive a 3rd dose. And the difference between a 3rd dose and a booster is the timing of that 3rd shot. So it's recommended now that kidney patients receive a 3rd dose, meaning that after you've received the 2 doses of the mRNA vaccines, you receive a 3rd shot about a month after the 2nd. And that those who have completed the 3-shot series, or if you'd received the 2-shot series some time ago, receive another dose, a booster, separated by 6 months after the completion of the 2 to 3 dose series. Again, don't forget influenza. We often think of flu as a relatively mild infection, and some have talked about that COVID isn't so bad because in many cases it causes just a bad flu. Well, this is a look at what can happen to those who get a bad flu. During the 2017-2018 flu season, 11% or almost 11% of the total number of people who died from flu. In 2018-19 and 2019-20, the numbers were better, but still, more than 7% of the people that died during those 2 winter seasons died from flu. So it's still a really significant cause of death. You'll note that there are really no data for the 2020-21 season because the rates of flu were very, very low across the country. A lot of that was probably due to the practices that were instituted as part of protection against COVID in terms of masks and social distancing. So this shows you a little bit about the infection rates in 2019-20 and so far this year. And you can see that the infection rates in 19-20 were much higher during the winter months. And so this is really the time of the year when we're starting to see influenza take place. And especially as we get further into the holiday season, the risk of influenza will increase greatly. The data from this year so far show very low rates of flu, which is really what's expected through the end of October. And it's really into November and December that we expect to start to see flu, so we shouldn't be too comforted by this data. As we look forward to the 2021-22 influenza season, we don't really have a good sense of what the influenza season will look like. Some have said that it'll be a bad season because very few were infected last year, so there's very little immunity against influenza in the general population. Others have said that it may still be a better flu season like it was last year because many people are still using masks and social distancing. Again, I would say that vaccination is the best protection that we can have, and coupled with proper use of masks and social distancing, we should be able to keep the influenza infection rates and the complications from them down low. So the best time for a flu shot is now. Much like with COVID, it takes time to build up immunity against influenza. Influenza vaccines provide protection for 4 to 5 months after they become effective, so that it would be expected that if you get a flu vaccine now, you'd be protected through March or April, which is really the peak of the influenza season. So how can you help yourselves? Again, the data is very strong, supporting the benefits of face masks and social distancing. It's also important to recognize that risks are reduced by avoiding crowded social situations, especially indoors where there's little circulation of air. As we'll talk about in a few minutes, that doesn't mean that you can't spend time with friends and family, but it does mean that you should be very cautious about attending social affairs where there are hundreds of people gathered, especially if those affairs are indoors and in a relatively small social space. So, is it safe to gather with people outside your pod? That is, outside of those that you normally spend most of your time with. The data and the recommendations from the CDC are that if everyone is vaccinated, it is safe, but it's still wise to take precautions. Generally, masks should be worn, especially indoors. Eating and drinking is safe, but it should be done as much as reasonably possible in a distanced setting. What does that mean? Well, it means that if you're sitting at a dining room table with your immediate family, those that you spend a lot of time with, and with others that you spend less time with, it'd be wise to have your pod kind of at one end of the table and others at the other end of the table so that there's at least some distance between you. Unvaccinated individuals should be advised to wear masks at all times, especially indoors, and should ideally eat separately, meaning again, either in a separate room or certainly with a greater distance from those who are at risk. What about travel? As Paul pointed out, a good number of you are planning to travel this year. So private cars are certainly the safest form of travel. When you drive in your own car, you're not going to be exposed to others who may or may not be vaccinated, and you're not going to risk that they don't use their masks properly and that you might be exposed to infection. That said, buses, planes, and trains can all be used safely. If you're going to travel by public transportation, I recommend wearing a mask at all times that you're in a bus station, plane station, or train station, and certainly during the time that you're on those forms of travel. Clearly, when you're on an airplane or in a bus, there's very little air circulation. So if it's possible, especially on a bus or a train, it makes sense to keep windows open to allow for as much air circulation as possible. I strongly recommend frequent use of hand sanitizer. It has clearly been shown to reduce the risks not only of viral infections like COVID and influenza, but certainly bacterial infections as well. I recommend carrying antibacterial and antiviral wipes with you when you travel, cleaning your seat and surrounding areas. If you're going to touch things like call buttons or food trays, I recommend wiping them down before touching them. I do recommend avoiding eating and drinking during travel. Now, obviously, if you're on a bus or a train for 12 hours, that's not a reasonable possibility, but I do recommend limiting that, social distancing as much as possible, and wearing your mask as you're chewing and sort of between food as much as possible. So how should we look at celebrating the holidays in 2021? I think it's really important that we all take the time to be thankful for all the blessings that we have, for our health, our loved ones, and the fact that it does look like COVID we're over the worst of COVID. Take time to appreciate everything that you do have, and most importantly, have fun. I think that's my last slide, so I'll stop there, and I'm happy to take any questions.
Thank you so much, Dr. Silberzweig. We appreciate you joining us once again this year to share information about staying safe. We do have several questions that we've received in advance of the webinar, and I will start reading those out loud for you. First question is, some of my dialysis friends and even some transplant patients seem to be more relaxed this year, and some may take more risks with the holidays. Are we safer this year? What are the best guidelines to follow for all, including CKD patients, for the holidays?
Yeah, it's a great question. So I think that certainly we're safer this year than we were a year ago, especially those who are vaccinated. I still think it makes sense, as I said earlier, to wear masks, to practice social distancing where it's reasonable. I think that applies to all kidney patients. It certainly applies to those with transplants and those with chronic kidney disease who may be on immunosuppressive medications. It's also clearly been shown to be the case for those who are receiving dialysis. And we think that that's probably because their immune systems don't work perfectly, so that there is increased risk of infection and of complications should they become infected. So again, I strongly recommend being vaccinated. I think that's the best protection that we have. And for everyone, whether vaccinated or not, I recommend the use of face masks and the use of social distancing where possible.
Thank you. Does a triple vaccinated kidney transplant recipient need to wear an N95 mask plus a face shield if they're traveling by plane and in the airport?
Yeah, so air travel, as I touched on earlier, is a little bit of a complicated situation. The CDC does say it's safe to travel. Obviously, they're the authority on it. If somebody is triple vaccinated, as we touched on earlier, meaning that they got a 3-dose series or that they got a booster, they're certainly as protected as they can be. That said, if I were talking to my patient who had received 3 vaccines, I would certainly recommend using a face mask. And if you're going to be eating during travel, that probably is a great time to use a face shield if you have it, because I think that you can reasonably use a face shield and still eat at the same time and still have a good degree of protection from the face shield as well as the vaccination.
Great, thank you. That is a good point about the face shield being a little bit easier to eat while you're wearing one of those. So some of these questions you've touched on a little bit during the presentation. We have one person asking, do we need to be concerned about catching COVID from fully vaccinated family members?
So there is data indicating that those who are vaccinated can carry COVID even if they don't show signs of infection. So again, the breakthrough infections are likely to be much less severe, meaning that individuals who develop breakthrough infections are far less likely to have symptoms than those who are not vaccinated. So it is possible that an individual who's been vaccinated has a mild infection, and that infection can in fact be passed on either to somebody who's vaccinated or certainly to those who are not vaccinated. So yes, by all means, you should take precautions even around those who've been vaccinated because they can pass along infections.
Thank you. And along those lines, what precautions should a vaccinated kidney patient take to protect themselves from perhaps children or younger individuals who cannot yet be vaccinated?
Excuse me. So as I touched on, vaccines for children, that is those aged 5 to 11, just became available in the last week or so, which means that most of those children, even if they had made the effort to get vaccinated right away, will not have full protection by the time of the holidays, certainly not by Thanksgiving, and likely not fully by Christmas either. Obviously, children under 5 are still not eligible for vaccines, so they won't have any vaccination. And therefore, I do recommend taking precautions if you're going to spend time with young children this holiday season. Certainly, I would encourage those of you who have children or grandchildren not to miss out on the opportunity to spend time with them. I would recommend that both you and the children wear masks if that's at all possible. I do believe that that significantly reduces the risk of infection if, God forbid, the children do get infected. But I do think that you can spend time with them. Just be really cautious about doing it.
Thank you. One additional question here. Is it safe to attend crowded indoor performances where everyone is wearing a mask?
You know, I'd be very hesitant in crowded social situations, as I mentioned. I think that even if everyone is vaccinated, in a crowded social situation where people may be carrying mild infections without significant symptoms, there is definitely risk of spreading those infections. So I would definitely be really careful in that kind of situation. Personally, I would avoid it. But if there's, for whatever reason, you feel like you need to be in a crowded social situation like that, I would certainly recommend wearing masks, ideally an N95 or a KN95 with a second mask and or a face shield. I think that's going to reduce risk as much as is possible. But personally, I would avoid those situations.
Thank you. AAKP recently held a webinar on monoclonal antibodies. And one question that we have is, when do you think the FDA will determine if immunocompromised individuals should be given this monoclonal antibody exposure?
Yeah, so that's a really good question. The studies that have been done so far have looked at individuals who are in settings where they're going to be exposed to COVID-19. That is, for example, those who live in a group setting or with family members who've become infected, so they know that they're being exposed to COVID-19. And when those individuals received monoclonal antibodies, they did have much lower rates of infection, and therefore it seems to be beneficial. We have pretty good data now that monoclonal antibodies are safe and effective in patients with kidney transplants and, in fact, in dialysis patients as well when they've been exposed to COVID-19. We do not have data on prophylactic use of monoclonal antibodies in kidney patients. So we can't speak to that specifically. You know, I have every reason to think that they might be safe and that they might be effective. I think that those are studies that are ongoing now, as are studies with the new oral antiviral drugs that have come out over the last few weeks. And so I think that we'll start to see data for kidney patients with those medications over the course of the next couple of months. And I would not be surprised if there are recommendations for their use, but it probably would be 2 to 3 months from now till we start to hear about those recommendations.
Thank you so much. And I'd like to end here our Q&A session with one question that's a little bit more on the fun side. And this individual would like to know if you have any good food substitutions for kidney patients during the holidays.
Well, I would really prefer to refer that question to my wife, who's a dietitian. But you know, for kidney patients, particularly for those on dialysis, potassium is really the thing I worry most about. And as we all know, major sources of potassium are things like citrus fruits, particularly oranges and tomatoes, things like bananas and plantains, and green leafy vegetables. So, you know, those are the things that I think you need to be cautious with. And if you're going to be looking at your citrus fruits rather, I would certainly recommend grapefruit rather than oranges or mangoes. And in terms of your vegetables, I'd recommend things like carrots and other vegetables like that rather than the green leafy vegetables. You know, in terms of potatoes, which I know is another source, I think that if they're treated properly, meaning that they're soaked before cooking, I think that they can be used reasonably safely, and so it becomes very feasible to enjoy the holiday season.
Thank you so much. We appreciate all of your time today, your expertise, and all the information that you provided to us. Thank you for being such a wonderful friend to AAKP and for joining us today.
Thank you very much, Erin. Again, I'd like to express my appreciation to you, to Paul, to Richard, and to AAKP for their collaboration, both throughout the COVID-19 pandemic and throughout as advocates for kidney patients.
Thank you. If you have a question today that we didn't get to during the webinar, you can reach out to us at info@aakp.org. We do have a few closing slides that I want to go through with you. If you are not already a member of AAKP, we encourage you to join. We offer free membership to patients and family members as well as living kidney donors. You can become a free member online at aakp.org or by phone. And in order to receive all of the benefits of membership, we encourage you to include your email address when signing up. And you will be notified when opportunities arise where your opinions and experiences are needed to help inform innovation, advance care, and make a meaningful impact to improve lives. We encourage you to respond to our flash surveys and other engagement opportunities to help us elevate the patient voice and change the status quo for kidney disease care. You can also select to receive any of our 5 different electronic newsletters and subscribe to our printed magazine, AAKP Renal Life. We also invite you to follow us on our blog and social media for all the latest news and announcements. AAKP is dedicated to helping patients understand their condition and take control of their healthcare. We are proud to offer a variety of resources for both patients and caregivers. We also offer numerous kidney-friendly recipes with details on the nutritional content and which stage of kidney disease these recipes are good for. By visiting our website at aakp.org and clicking on the AAKP Store button at the top of the homepage, you can find a variety of educational brochures and online tools to order or download. And you can also order materials by phone. We encourage you to visit our on-demand webpage where you can find educational sessions from previous events such as our Global Innovation Summit, Policy Summit, and National Patient Meeting. We also have a plethora of resources on our coronavirus resources page that we regularly update. You can access this page from this link or by clicking on the big red button from our AAKP homepage. We'd again like to thank today's speakers, Dr. Jeffrey Silberzweig, Richard Knight, and Paul Conway for sharing information about staying safe while enjoying the holidays. We hope you will continue to be informed and stay safe, and have wonderful holidays.